Hello, everyone.
Good morning.
Today I'm talking with Dr. Stachowicz from Authentic Plastic Surgery here in Minneapolis, and we are going to be covering some of the topics that go along with a breast cancer diagnosis. And starting today, talking about after that initial breast cancer diagnosis, what comes next. Making sure that you are identifying your fears and your stresses, and also what comes next, what you need to do as far as who you're going to need to go see, and what decisions you're going to need to think about making. So with that, I'm going to go ahead and turn it over to you and let you kind of go from there.
Very well.
Thank you for being here.
You're welcome. Um, I think that in my observations over past years, I've noticed that the situation often becomes overwhelming right off the start.
Absolutely.
It's very stressful. I think that oppressive feeling of something horrible happening is very stressful to everybody. Um, what makes situations more difficult is that once the diagnosis is made through whatever means, whenever it was a mammogram or a biopsy, what have you, the next step, i.e., the consultations with specialists, will not typically happen the same day. They will be some days, several days, maybe even a week of delays, scheduling conflicts, etc. And I think that leaves people vulnerable to sort of having too much time to think.
Yeah, absolutely.
Unfortunate effects of internet is that information is out there. The problem is very little of that information is actually pertinent to each specific patient.
Sure. And correct information. There's a lot
Yes.
of incorrect information out there that people
And
read
then
to.
you add to it sort of the situation where well-meaning friends and family are trying to
Yeah.
add their own experiences. Again, very few of them may be relevant to that particular case. That is,
Sure.
every diagnosis is in a way different.
Yep.
Treatment options are certainly wide and many, and not everybody will be treated the same way. Often patients show up for consultations feeling that their treatment is somehow deficient because it's not like somebody else's.
That's a good point
So
too.
again, it's a very important thing not to fall into the trap of sort of overthinking the situation when there's not enough data.
Well, and I think that makes a good point too in the fact that you can't compare your situation to anyone else's. Everyone's situation is going to be different. Everyone's diagnosis is going to be different. Obviously, there are many types of breast cancer out there, and so it's important to really just focus on yourself. And in those first few days, I know you've said so. Stay away from the internet initially until you have more information about what your specific
What you're
situation
exactly
is.
supposed to be looking for.
Yes, and then also you talked about
Preparing.
preparing, and as far as if you've got stresses and fears, identifying those, writing those down, and writing down your questions.
So I think I am not uncommonly contacted by friends or people who know what I do with the same question. So and so has been diagnosed. What do we do next?
Okay.
So whenever I have that chance that I am interacting with a patient who just is moving through that initial steps, I try to redirect their fears into more of a constructive behavior. That is, start a notebook,
Okay.
write your questions down, however they feel irrelevant, write them down. Create a folder, a three-ring binder of some sort that you can keep track of every upcoming appointment, have a calendar there for every appointment that is being scheduled. Whenever this is a oncologist or general surgeon or other specialists like genetic testing, write down the questions, write down the concerns, and so on. The other aspects you and I have talked about in the past is I often recommend virtually, I think that one of the best things one can do is to bring somebody with for an appointment.
Yeah.
Hopefully somebody who is not necessarily so directly emotionally involved.
Absolutely.
Somebody who can pay attention. Maybe it's the friend. Many breast cancer centers offer chaperones that can accompany you to those
Mm-hmm.
consultations. Again, I would ask about that.
Sure.
Those are people who've been through this before.
Which is nice because you may have your friends and family surrounding you that are just too, their emotions are running as high as yours, and stress, and you really need that calm during those appointments to keep
Right.
you focused on getting the best care and taking care of your needs and moving on to what's next so that you can move on from this successfully.
I think it's important to point out that during the course of, say, half an hour or 45 minutes of consultation, the amount of information provided is staggering.
Yeah, absolutely.
And one other aspect that one should sort of remember is that there will be at least 3, 4, 5 people involved in your care.
Mm-hmm.
There's going to be a general surgeon. There's going to be an oncologist. There's going to be probably a genetics consult. There's going to be various aspects of pre or postmenopausal type care. Some treatments of breast cancer will affect the hormonal status, so there will be other specialists involved. And ultimately, at some point, there will be treatments discussed, the plan of treatments.
Sure.
Whenever one is proceeding with an option like lumpectomy, for example, that does not always require a reconstructive approach, versus mastectomy, which typically requires reconstruction afterwards.
If they go that route.
Whenever that topic comes up, again, right away, consider seeing a plastic surgeon. What often happens, even in well-organized centers, is that plastic surgeon comes up sort of as an afterthought. And just because you're seeing a plastic surgeon doesn't mean reconstruction has to happen.
Sure.
It just simply means that you can get information from a different perspective. We are routinely taking care of those patients for much longer periods of time down the road. And we were able to give them idea what it really means, for example, to have radiation in terms of practical. How's it going to feel a year or 2 or 3 down the road?
Sure.
If we're doing this type of reconstruction, what does that mean 10 years afterwards in terms of do we need to do any revisions or corrections?
Sure.
Again, I think catching that information ahead of time and not being sort of waiting later for that consultation, that can be a big time-saving device.
I think it's important to be educated as much as possible. Like you said, initially meet with that reconstructive surgeon early on so you can decide, am I going to do reconstructive? Am I not going to do reconstructive? What are the benefits of
doing it or not doing it.
Exactly.
Simple.
And then being able to hear it from someone else, and so after even after that initial diagnosis with the oncologist, that's a great time to ask who they recommend or who they work with that's a reconstructive surgeon. And then to also be mindful of what your needs are. You may want someone who has bedside manner, and not all surgeons are great with their bedside manner, so that might be an important thing for you that you'll want to keep in mind, and let your surgeon know that this is important to you, or or whatever needs you have, that they are going to be mindful of that when deciding who they are recommending to you.
Yep. And I think just again, to summarize, find somebody you can go to the appointments with.
Yep.
If that is possible. If not, ask for there's organizations or volunteers who can do this.
Which is great.
Often physicians, surgeons will, like myself, I have patients who I know are willing to, if not in person, then over the phone, be sort of that more removed, not so emotionally involved chaperone in a way.
Absolutely.
And again, that is all out there. It's important to ask, take notes, keep them organized.
Write down your fears, your stresses, make sure those are being addressed.
Stay away from Google.
Yes. And the internet has its place. Once you have your diagnosis, once you've gone through it, there are so many online communities that can be of help to you and benefit and support and all of that. It's just that initial time when you just need to wait until you have all your information and you know the direction that you're going and the decisions have been made. So I think that
I think that covers the basics, and
yes.
The questions, we'll be happy to answer them. Right?
Absolutely. Feel free to message us. We are both on Facebook. You can reach Dr. Stachowicz through Authentic Plastic Surgery. in Minneapolis, and we are heart&core spelled out. You can come message us through Facebook as well, or info@heartandcore.com, and we'd be happy to help you in any way that we can. And we'll be doing more discussions about this, other aspects of the breast cancer, the process of going through breast cancer and breast cancer surgery. So thank you so much for being a part of this, and or listening to us, I should say, and have a great day.
Thank you.